to see that you're awake. So you were having, yes, do you remember what happened? Okay, on the cruise ship? Yes. So you had definitely a big fall. We ran some tests to make sure that you're doing okay and noticed no signs of aneurysm, major concussions, brain bleeding, or damage. So it just seems like you are in great need of rest. So what I'm going to do is just ask you a series of questions, okay? And just answer as best you can. Can you verify your first and last name and date of birth? Good. Okay, great. And do you have any pain right now? Okay. On a scale of 1 to 10, how would you rate that pain? Okay. And then where is it located? Is it the head? Okay, what about the shoulder? A little bit. Okay, because you did have some bruising there. And something we're going to keep track of for sure. Okay. So, do you have any history of neurological problems? No, lung disorders, blood disorders. Okay. Dizziness on standing, a racing heart. Okay. Okay, and is that every time you stand or on certain occasions? Okay, well, that makes sense. I don't think that there's a problem there. Okay. Alright, well, if you have no other issues or things to bring up, I'm going to go ahead and begin the exam. I'm going to take your vitals, listen to your heart and your lungs, and I'm going to just make sure that you're doing okay. Alright, do you have any questions for me? Great. You seem like you're still sleepy, so you can go ahead and drift off to sleep if you need to. Okay. I'll let you know if I have any questions for you. I will. But for now, I'm just going to listen to your heart so you can just be as calm and sleepy as possible. Okay. Okay. So go ahead and just breathe normally for me. Okay, I'm going to flip over, listen on the bell side. Any murmurs or... Okay, good. Only S1 and S2 are present. I cannot hear S3, which is a good sign. Okay, I'm going to listen to your lungs now. If you could give me a nice deep breath. Beautiful. Okay, sounds good. I'm going to listen on the other side. Another deep breath for me. Okay. Sounds normal. Okay. Just gonna go ahead and write that down. Okay. Gonna go ahead and get your temperature. Okay, hold still. Perfect. Okay, it's a little low, 96.1. Are you chilly? Okay, we'll try to turn the heat up here. I know it's getting cold, so let's ease it. And next we're going to do your oxygenation. If I have that meter here, go ahead and put this aside. Okay. Just gonna get your index finger. Okay. Okay, great. Okay, your heartbeat is 78 beats per minute. Oxygenation, 99 per rare. That's good. Everything's normal so far. Okay, I'm just gonna grab both your arms and just feel your pulse right now. Good. Great. Okay, so I'm going to come a little bit closer to begin a facial exam, okay? I'm going to place both of my hands gently on both sides of your face, okay? Now go ahead and close your eyes. Good. Now when I press against your face, do you feel that equally on both sides? Okay, good. Good, okay. Now I'm placing my hand directly on your chin. Try to look up at the ceiling for me in 3, 2, 1. Try to look up. Good, okay. Now I'm putting my hand right under your chin. Try to touch your chin to your chest. 3, 2, 1. Okay. Go ahead and look to your left. 3, 2, 1. Good. Look to your right. 3, 2, 1. Good. Now I'm placing both of my fingers directly on the bridge of your nose. Try to move your head side to side. Okay. Alright, great. Okay, so next I'm going to be taking a look at the skin. Just going to look here. Seems to be very well perfused. Don't see any signs of scarring or scratching. No signs of redness. No yellowing of the skin or purpling. Okay, go ahead and turn your head this way. I'm just going to look here. Okay, good. Just looking for signs of proper blood circulation. Any patches of purpling would be a concern, but I don't see anything right now. I'm going to come a little bit closer and do some percussions, okay? You're going to feel just like a tap like that on the face. Go ahead, hold still. Okay. Okay, and let me know if you feel any pain. Is that painful for you? Okay. So that's normal. Now I'm just going to feel pressing. I'm going to be feeling on top of your head. Okay. And then right behind the neck, along the mastoid bone. Right along your cervical spine. Pain here? Okay. Pain here? Good. Okay, just going to go a little bit lower. Any pain? Okay. 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 We're going to do a sensory test now. I just want to check and see your skin's perception to temperature. Okay? So close your eyes. Okay. Do you feel the sensation as I tap on you? Okay, so that's cold to you, isn't it? Good. And then this is a fluffy tool. Okay. So close your eyes and say cold or dull. Dull when you feel the fluffy tool and cold when you feel the glove. Okay? Okay, close your eyes, close your eyes, close your eyes. Okay. Good. Yes. Yes. Good. Yes. All right. Excellent. We're going to be doing a smell test next. I have some scents for you to smell. Just want to make sure that your cranial nerves are intact, okay? So go ahead and close your eyes. Inhale. What does that smell like to you? Good job. Go ahead and inhale. And what does that smell like? Okay. Go ahead and inhale. What does that smell like to you? Good. Okay. Go ahead and inhale. What does that smell like to you? That's very good. So I'm not too concerned with your sense of smell. Some of your responses were a little bit off, but but not too much to make me concerned, okay? Do you have any issues with smelling things that aren't there? Smelling things like smoke or a metallic smell in a room when no one else does? Good. Okay, that's good. So next, I'm going to just go ahead and check. I'm going to check your eyes and ears, okay? You go ahead and take a look inside. Okay, coming a little bit closer. Alright, look to your left, look to your right, look up and down. Good. I don't see anything abnormal here. Your eyes are a little dry. And I know you had mentioned that you wear contacts. What's your brand? Okay, I can write down a few other options that might give you a little bit of alleviation there, okay? Other than that, they look really healthy. Going to look at the other eye now. You're doing great. Look up, look down. To your left, to your right. Now roll your eyes. Alright, was that painful for you? Good. Okay. Next, we're going to do some simple vision tests, okay? So go ahead and look at my nose, the very tip of my nose. Pay attention. Good. Okay. So let me know which fingers are moving, the fingers on your left or your right. Good. Good. Now, which fingers are closer, the ones on your left or your right? Good. Which fingers are closer, the ones on your left or your right? Good. Okay. Let me know when my fingers leave your field of vision. Say now. Yep. Good. Good. Now, look here. Let me know when my fingers enter your field of vision. Again, say now. Yes. Oops. Okay. Beautiful. All right. So I'm going to write down that range of motion is intact, very much intact. Okay. Let's go ahead and read the Snellen chart. Can you read it? Let's put that to the test, okay? Start with the O. Read that row right there. Just that row. Oh, see that. Okay. Now what about this row beginning with the E? And what about this last row beginning with the L? Good. What color is this? Good. What color is this? Good. And is number 2, is this circle a small circle or a large circle in the grid? Okay. Is number 5 larger or smaller than number 4? Good. Is number 7 larger or smaller than number 6? Excellent. So you have 2 lights here. Do you see them? One is pink, one is yellow. I want you to follow the pink light. Only the pink light. Keep following the pink light. Okay, good. Now follow the yellow light. Good. Good. Great. I think that your eyes are very much intact. Okay. Next, I'm going to look inside your ears. Okay. Go ahead and turn your head this way. Just looking inside the ear. Okay. You do have some wax that I would encourage you to clean up on your own. Other than that, the tympanic membrane is pro-gray, visible. Let me go ahead and look one more time. Yes, you do a lot of hair in your ears. A lot more than I've seen regularly, which is funny. Go ahead and turn this way. Okay, look at the other ear. Okay, this ear is a little cleaner. And it looks healthy. No issues. Great. Okay. I'm going to whisper some things. Go ahead and repeat exactly what you hear after me. Ghosts, goblins, flower, golden light, pink ribbon, red letters, blue sky, furniture outlet, Fern Gully, lipstick. Okay, that's good. Good, good, good. I have some tuning forks I'm going to be using on you. Okay. She already knows that the tuning forks are coming. She's getting a little bit keyed up. Okay, so this is more to test activity in your resonance chambers. Let me know when the sensation stops. I'm going to be placing it right on the chest. When it stops, say now. Good. Good. Okay. That's okay. Alright, we're going to do another tool. Good. Good. Okay. Okay. That's okay. That's okay. It's okay to be it, to do it. Okay. Sorry, I had to give a little reassurance talk here. Okay. So, coming a little bit closer, I'm going to be making a little sound with my gloves on both sides of your face. Let me know if you hear it on the right ear or the left ear. Both good. Good. Excellent. Okay. So, I think next we're going to do just some measurements of the base, just because we need to encourage symmetry and see if the concussion is healing on this side. If there's a lot more edema there, I'm going to put it down in my notes, okay? So you can close your eyes, drift off to sleep. There's nothing you have to do. All the tests are paused. Okay, just making this here. Just over forehead, okay. Are you comfortable still? Okay. I can see you're kind of nodding off. It's okay. Okay, let's see. Just going right. Almost 20. Just gonna go right up. Okay, let me see if we got okay, that was 15 and a half. So that's a good reference point for just this side. This side was the one that was affected the most. 7 and a half. So a little bit more on this side. You can see what this is like. Just looks good. Just gonna. Okay. Okay. Okay, just gonna turn this right at this side of the face. That is 10.2. Normal. Purple here, and then this is going to be 11. Okay, just gonna put that down real quick. I'm just seeing a little slight indentation on here. So I'm just going to measure that. It's very tiny. It's about a millimeter. I think it's a angioma. It's just good that we had that written down. Okay. Let me go ahead and feel your thyroid here. Is that painful? I'm just going to squeeze very gently on the neck. Okay. Good. Painful? Feels normal. When I feel your lymph nodes here, I forgot to. The preauricular and post, okay. Normal size lymphs. We love to see that. And okay, sit. Okay. Actually, I'm just going to go ahead and use this. Go ahead and open your mouth. Say, ah, good. Okay, I'm just going to very gently just push back this side of the lip. Okay, this side as well. Pain there. Okay. Seeing a little bit of redness, so I'm just going to take a sample just to have for our records. I'm going to use one of these. Okay, go ahead and open your mouth. Just on this side, I'm just seeing a little bit of redness. Just gonna send this to our laboratory. Okay. Okay. And actually, I'm just gonna tap really gently on your teeth there. I'm just gonna take a look. So I'm gonna tap right on this bottom one. It's kind of like near where I saw the abrasion. Was that painful? Okay. Just gonna look here. Just gonna go a little bit closer. Okay, I'm just gonna gently just peel back the mouth there. Okay. Do you bite your lips or do you chew on your lip? Okay. Do you have a salve for that if you're open to it? Okay, yeah, I see it's just a little bit torn there. Took a sample just to make sure there's nothing bacterial going on, but here. Pain there? Okay. Pain there? Okay. Okay. Go ahead and open your mouth. Open your mouth. I'm just gonna swoosh that around. Okay, good. Great. So, we got our measurements here. I'm going to just put some of these items aside. Okay. I'm just gonna go ahead and palpate your abdomen if that's okay. Alright, I know it's tender because of the fall, but just bear with me here. And let me know if you feel any pain. Any pain? Okay. Okay, so I'm going to feel right underneath the ribs. Is that painful for you? Okay, on a scale of 1 to 10, how painful? Okay, I'm just going to go a little bit lower. I'm just going to feel your liver here. Normal in size. It's your thyroid area. And spleen. Take a nice deep breath for me. Okay, I'm going to go a little bit lower and I'm going to feel your thyroid. Okay, just going to do some more palpations here. Okay. Great. Any pain? Alright, I'm going to go ahead and take a listen to the stomach as well. Okay. Okay. Take a nice deep breath for me. Some acidic acid buildup, but I think it's because you're hungry. I heard your stomach growling. Okay. 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 So just as a precaution, I'm going to do a pressure point test on your stomach. I just want to make sure you're not feeling numb there. This is 1 pressure point. This is 2. Do you feel the difference? Okay. Say 1 or 2. Close your eyes. Yes. Good. Yes. Good. Okay. Yes. Okay. Good. Okay, what about now? Okay. Sorry if that poked you. Sorry about that. Uh-huh. Okay, so I think that's good. Okay. We're going to do the same thing. We're going to do a type of pressure point test on the chest. So this is 1. This is 2. Do you feel the difference? Okay. Now it's going to be over your blanket, so you shouldn't feel any sharp pain. But let me know if you do. Okay? Close your eyes. Okay. Keep your eyes closed. Close your eyes. Good. Okay. Good. Yes. Good. Good. Yes. That was 2. Good. This one, okay. And I'm going to be putting just 1 pressure point. Let me know if it's on the left or the right side of your chest or the center. Yes. No. Good. Okay. I'm just going to feel that area here. Is it tender? Okay, that's the side of the shoulder. Just going to squeeze gently on the shoulder. Is that tender for you? Sorry about that. Okay. I'm just going to peel back and take a look if you don't mind. Yeah. Still very swollen. Just going to just measure that real quick. On this side. Definitely just going to take some time for that. I can bring in some ice as well. I know you are feeling a little cold, so that probably doesn't sound like the best, but we'll do what we can, okay? Sorry about that. Okay, I'm going to just write that down. A little bit of swelling and pain on the right side shoulder to be expected. Okay. Great. Okay. Next, I have a testing strip. I just want you to taste test this one item here. Open, close, open. What that tastes like to you? Okay, good. Now this next one, go ahead, open your mouth, close, open. Okay, close enough. Any issues with tasting things that aren't there? A foul odor in the mouth? Okay. Huh. Yeah, it could be. I'm going to just make a note of that. And so you said in the morning? What's your nighttime dental routine? Do you brush? Do you floss? Sometimes you forget. Okay. So that could be where the problem stems from. I didn't notice any signs of cavities or plaque when I looked inside your mouth, but I'm not a professional dentist. So if you have any concerns with that kind of halitosis, I would schedule an appointment. There's some medical grade mouthwash that could help for that. Okay, but I don't smell your breath right now. Your breath smells just fine to me, so don't worry. Okay. I'm going to just feel your feet here. Pain. Gently grasping your ankles. Pain. Pain here. Okay, what about here? Okay. Okay, I'm just going to gently press on the feet. Okay. Pain? Okay, pain. Okay, which side am I squeezing? Good. Which side? Okay. All right, so I didn't notice any significant issues. I know you're still having a lot of healing going on, especially in the head and the shoulder. When I took the measurements, I noticed that edema is going to go away within a couple weeks. You're admitted here at least for the next few days just to monitor you, okay? And what can I say? Next time I think you should just maintain your balance when you're at sea on a cruise ship, okay? Any more questions? Yes, we'll bring in those pain medications soon. Some more blankets. For now, close your eyes and drift off to a peaceful sleep, okay? Because you deserve it. All right?